Hi everyone, Assalamu alaikum. My name is Monique Tui, and this is an episode of Be Well for the Centre for Muslim Wellbeing. In today's episode, we will be talking about eating disorders and the work of Myah Turner-Revach, who's a telehealth counsellor for Eating Disorders Victoria. Eating disorders are something that occurs within all communities and also Muslim communities amongst both young men, young women, and adult men and adult women. And so today I want to give the community a little bit more information about what it is to look out for, how it gets identified or diagnosed, some treatment pathways, like how do you get someone assistance if you notice someone's eating patterns have changed and you actually start to worry about that and think that the patterns could be really starting to harm that person, or maybe they're a reaction to something psychological going on in someone's life. People cope in different ways, and sometimes people's eating patterns change as a way to cope. Not necessarily the healthiest form of coping, but that's what we're here to talk about. So thank you, Myah, for joining us from Eating Disorders Victoria. How are you going today?
Yeah, good. Thank you. And thanks for having me. Glad to
You're
be
welcome.
here.
Excellent, excellent. Now, well, we're really happy to have you because I think it's a topic that isn't discussed a lot in the community. I think as what we call a low prevalence disorder, something
Mm,
that doesn't occur too much in the sort of the natural occurrences of mental health issues. Some of these issues don't get discussed, and I think that they're really important to sort of bring to light. And that's what Be Well is all about: is bringing to light, I guess, the experience of different mental health issues that community members, including Muslim community members, experience, but we don't often get a deeper look as to, well, what is it? What are we looking for?
mm,
What are some of the struggles of people who might have an eating disorder? What might they be struggling with? And more importantly, how can we help?
I think those are some really good points, Monique. I think, I know from our perspective at Eating Disorders Victoria, we're very aware that within the population that even has or identifies as having an eating disorder, there's only about a third of that population that will then seek help. So there's definitely something in there about identifying disordered eating and eating disorders, and then there's also something in there about help seeking and knowing
Mhm.
how to do that.
That's right. I mean, I think quite frankly, when people undergo lots of different stress in their life, we just naturally, you know, wing it, as in we do the best that we
Yeah,
can to
yeah.
try and cope with stress, particularly young people, right? So we might have a variety of different options available to us, and we just unconsciously choose one that we think works, or one that does work, as in I think a lot of young people accidentally discover that certain behaviors work, and sometimes they're healthy and sometimes not so much, okay, even if they're working.
Hmm.
And that's a conundrum for young people to go, well, I'm doing this thing, I'm engaging in some types of behavior that I feel might help me to feel more in control or calmer, or feel less chaotic or something, or it might be, but it's just might have some other detrimental effects down the road and they don't know
No,
because it's
absolutely.
given a label. Yeah.
I agree.
Can we start? I just want to get a little bit more understanding about what Eating Disorders Victoria does.
Yeah, sure. So Eating Disorders Victoria, basically, we are a community-based, not-for-profit organization. We're essentially sort of set up to try and do our best to support Victorians who are either experiencing eating disorder or maybe supporting someone experiencing an eating disorder. And there's a number of ways that we do that. We have sort of strong education and advocacy focus. We do things like this, partnering with community, social media, all of that. We've got an online learning portal, so we understand that education and literacy around eating disorders for both people experiencing and people supporting them, that's really important. And then we also provide some essentially direct client work as well, but all through telehealth. So we've got a telehealth nursing program, we've got telehealth counselling, we have peer support programs, so a peer mentoring program, we've got carer coaching programs, we run online support groups, so more peer spaces. Um, yeah, yeah, we're doing what we can.
Well, that sounds actually like a lot that you're doing. I'm just re-rattling off all that's amazing. That's really good work. I'm so impressed already, because all those different programs make it so much easier for people who are in maybe different phases of their illness, or people who need to support someone. who a family member or a friend,
Yeah.
just to firstly get some information and to get help in different ways, because there's not a one size fits all approach to anyone's recovery from any type of illness, I don't think. And I think so the really broad offering there is really fabulous, from online, approaches and forums, and and particularly getting peer support, I think, is really hugely valuable. And I know one of the most effective types of treatment out there anyway. What's your role? What do you do? Tell us about your telehealth counselling. What does that look like?
Mm.
On any
So
given
yeah.
day, who calls you?
Ooh, who calls me? Look, it's broad and it's diverse. I think that because we work with both people experiencing and their carers. I mean, any day could be different. We'd also support health professionals as well if they just need a bit of support. But the counselling setup it's set up for brief intervention. So we're working off a fairly short sort of model of care. We're funded to offer about 5 sessions per year for a client.
Yeah.
Um, so it works really well for people who are potentially tapping in for the first time, needing to understand what's going on for them. We can help them set up referral pathways, understand treatment processes, get familiar with some of the language, some of the treatments that might be used. For some people, it's about tapping back in if there's been recovery for a period of time. It might be, just need to bounce back up after relapse.
Yeah. Yeah.
That's a really good space that we can provide there. Also, some people might have a lot of mental health literacy with other challenges that they're facing, but they haven't looked at the eating or the food stuff before, and it's just been sitting there. And then maybe that's where they tap in with us, and maybe it's about empowering them to look at that a bit more, or empowering them to bring this up in their other external support or whatever it might be. So yeah, it's pretty broad. Like, we can offer therapeutic support, we can offer advice and counseling depending on who it is that's coming and what exactly they need.
Yeah.
Yeah,
Yeah. And I mean, I think that's there's a fabulous point that you make in there. People may well have sought treatment for other types of mental health issues, depression, anxiety, and eating disorders have been, an eating disorder has been sort of brewing away in the background, or
totally.
at times really come to the foreground, but it may not be the type of work that they've brought up with their existing counsellor or psychologist, and it's like, come to me for one issue, type of thing,
Yeah.
and
And
not looking at everything that's going on in that person's background.
yeah.
Yeah.
And I think there's something there as well about the necessity that we have to educate and empower our health professionals to be asking those questions as well, so that a broader range of psychologists maybe are willing to ask the questions that they need to ask if they're looking at eating disorder risk factors or things like that.
Yeah.
And I think there's been some good work in schools over the years, getting school counselors to pick up on that a little bit more as well.
Yeah.
So yeah, it's a little bit of a bouncing, and we'll see what happens. I should also say that as well, because we're a free service, and we try to be as accessible as is possible. Obviously, not everyone is perfect in terms of accessibility, but knowing that sometimes we're also there for complexity. We're also there for people who need a free, accessible service, who are in a particular situation where nothing else is available to them. And that's where we can be there too.
Yeah, Myah, I mean, you point to some really significant limitations on the overall mental health system. And this is the truth. I mean, there's some really pragmatic issues that pop up for people who seek treatment for eating disorders in particular.
Yeah.
And one is if that's not raised, and then it's not activated in a mental health care plan system, or they're seeing a practitioner for something like depression and they get 10 sessions, but 10 sessions, a practitioner may only be able to focus on someone's, something to do with relationships or depression, for
Totally.
example, and not really be able to extend beyond that in a practical treatment approach, and or lack of training, as in don't want to touch it, or send it to someone who knows what they're doing. But then there's huge waiting lists for, for clinicians that are specialized working with people who have eating disorders. The waiting list can be a bit ridiculous. So I like the idea that it's, that this type of telehealth counselling is accessible and free. And I don't know about your waiting list, but being able to pick one's call, within perhaps, I don't know, a few days or a few weeks, or and get the process started for someone.
Yeah, that's a nice way to put it.
Yeah,
Yeah, we're limited in our scope to a certain degree, but we can help with getting that process started. And at the very least, I often think about my role as what can I do with 5 sessions that gives someone a good enough experience of therapy where they may be able to engage again in a way that will be helpful for them long term.
I love it. That's one of the best questions a therapist could ask,
Mm,
of themselves is how do I get you, my client, to feel safe in my care and want to come back?
that's it.
100%. Um, okay, we'll start with the basic question. What is an eating disorder?
Yes, what is an eating disorder?
Mm,
It would depend on the type of eating disorder as well. So there's something there about talking about the different diagnoses and their different diagnostic criteria as well.
okay.
But ultimately, what we're talking about with an eating disorder is, I think, what we refer to as a significant disturbance in a person's behaviors, thoughts, feelings to do with food and eating, and or to do with body image, weight, self-evaluation in terms of body. And we're talking about that to a degree in which that there are potentially physical or psychological or quality of life impacts that are detrimental.
Mm, yeah,
Mm.
yeah. And that last bit in terms of evaluating, like how does someone themselves make that determination whether where their eating is actually detrimental to themselves if in some weird way it's having an emotional benefit?
Yeah, and that is the conundrum of an eating disorder, isn't it? Or of any potentially gripping coping mechanism that's actually turning out to be a little bit negative.
Yeah,
Look, there are other signs that we can look out for. So if we're getting into a point where we're undernourished, where we're low weight, if it's a restrictive type of eating disorder, that's going to impact you in terms of mood and lifestyle, and potentially relationships and ability to cope and ability to live your life and be out there, let alone just the basic sort of physical risk there is of being undernourished and malnourished.
yeah,
If we're talking about a different diagnosis, maybe that leans more towards the binging or the binge purging. I mean, when you get to like eating disorder diagnosis state, these things are happening quite regularly in your life.
yeah,
So you might be isolating yourself to engage in these activities, or potentially you might stop feeling safe or capable of engaging in other parts of your life without these activities or knowing that they're there. So
yeah,
potentially it's a tricky line. How does one evaluate that? But and we might get to this a bit later in terms of disordered eating versus eating disorder, but if it's
yeah,
getting
yeah.
into that eating disorder point, it's probably taking up a lot of time, a lot of thoughts, a lot of feelings. It's impacting
Mm.
you.
Would it also be true that someone just couldn't stop it?
Yeah, totally.
As in, they could go, they might recognize and go, I would like to stop this, or this is probably not so healthy. However, I can't see my next 24 hours ahead of me without engaging in some type of behavior.
Yeah, absolutely.
Sort of thinking, this is going to be a shadow that's going to be with me for a little bit. And when we talk about disordered with any type of mental health issue, we talk about some fairly significant impairment in one's ability to cope, their occupational functioning or their interpersonal relationships, that whatever the behavior is, that it starts to feel a little bit outside of your control, even though it may not have felt like that to begin with. And then it starts to interfere with other parts of your life. And then that feels a little bit out of your control.
Yeah, absolutely. I think that's a
Yeah,
beautiful way of putting it as well.
yeah, yeah. And early intervention is the key for eating disorders, isn't it?
Yeah, well, we know that there's,
Really one of those important keys.
yeah, definitely a higher chance of recovery the earlier you can seek help.
Find it. Yeah.
Mm.
So maybe we'll start by looking at, well, what's the difference? I think if someone's in our audience and going, well, I don't know how healthy my eating is, when does it start, or I might be engaging in a few behaviors which I think from what maybe social media has said to me that it might fall under an eating disorder, but how do we know the difference between disordered eating behavior and a clinically significant eating disorder?
Mm. Look, it's a good question. I think, like, let's also consider that everything happens on a spectrum anyway. So sometimes if I think about an eating disorder, you can also break it down potentially into some symptoms that might be occurring. So it
Okay.
could be that there's food restriction, or there's food rules, or there is binging or purging type behaviors, or avoiding certain types of foods, or feeling discomfort, things like that. They are all symptoms of an eating disorder, and disordered eating potentially just could be some of those symptoms that are happening, but they don't fit specifically within a clinical diagnosis, and maybe they're not happening at the same level of occurrence as we would need for a diagnostic diagnosis.
Okay. Okay. That's a good way to describe it. It's,
Mm,
having sort of an experience where you might have felt really uncomfortable or something really adverse, like some stress experience, and one of those things that you've done to cope with that one-off experience has involved something to do with your eating, right?
totally.
Yeah, so that'd be more like that's okay, it's a coping mechanism, but it's more like a one-off, or it's very incredibly infrequent and by no means influences your next 24 hours.
Potentially, but again,
Okay.
it is a spectrum, because we also know that there are certain disordered eating behaviors that are risk factors for eating disorders, and that's important
Mm,
to know as well. For
okay.
example, dieting. There's huge diet culture out there, and a lot of people partake in dieting, and we have a lot of messaging around that, but that can be a really, really significant risk factor for developing an eating disorder.
Okay.
And that is, in a sense, potentially disordered eating.
Mm,
So I think, like you say, it is hard to judge. I think if you feel that there is something there that you would like to change, or if it is impacting you, like we spoke about earlier, in any way, it's up to you. If in any way, if
yeah.
it's not working for you, I guess that any sort of any health clinician can address disordered eating with as much sincerity as you would address an eating disorder anyway.
Okay. Okay.
Mm.
Are there other types of risk factors to the development of an eating disorder?
Yeah, definitely there can be. So I think, like with any mental health disorder, which I'm sure you know about, Monique, there's like, often we think about physical risk factors, psychological risk factors, sociocultural risk factors. And
Mm,
so, within each of those broader categories, it might be genetic markers. So we know there are genetic markers for an eating disorder
okay.
in a person. It could be family history of an eating disorder,
Mm,
or it could be even family history of other mental health disorders as well. Um, and then if we look at potentially psychological risk factors, sometimes we think about perfectionistic traits,
mm,
obsessive compulsive behaviors, high anxiety. Honestly, there's quite a list of potential mental health illnesses that could be risk factors. You're
yeah.
looking at
Yeah.
an over-evaluation of self and of body.
You're right.
Um,
Yeah.
we also actually know that there's I wouldn't label this as a, sorry, interrupt me if you need to, but I wouldn't label this as a risk factor necessarily, but we know that there is a high correlation that's coming through at the moment with neurodivergence and developing eating disorders, and there's something to be aware
Mm,
of there as well.
yeah. Yeah.
Um,
I know that it's certainly becoming more common to be assessing if when ADHD is being assessed to, also assess for sort of eating disordered behaviors as well.
mm,
So I think that that's coming sort of, it's becoming more popular now that both are being assessed at the same time to see if there's something there. So yeah, I'm not sure what your thoughts are on that.
yeah, well, I think that there's still research to be done in the area, in the space, but you can think about you can think of it through that coping mechanism framing that we've been using, in terms of if potentially you're masking in an autistic or an ADHD sort of perspective, then that could be helping with that. It could be helping
Mm,
to regulate dopamine. It could be helping to stimulate dopamine. It's
mm.
yeah.
Yeah, that's fascinating. If you're worried about someone in your sphere, I think within Muslim communities, in certain parts of our communities, when I've worked as a school counselor in Islamic schools, there are Muslim girls in particular that I've worked with that have had eating disorders, particularly anorexia nervosa, and at times because of Muslim women wearing sort of baggy clothes
Mm,
or just uniforms being, oversized and, loose fitting
mm,
and
mm,
hijab, that I think sometimes that immediate weight loss can be hidden and at times then no one picks it up quickly, right?
Mm.
So just because certain parts of our body are not being revealed and the shape is at times concealed, and so what you might otherwise think is just normal attire, within parts of our community hides something underneath, and that's not that it isn't common when that happens, but I think it's something to look out for. And I guess if you're a friend or a family member and you're around loved ones much more often, what do you think gets picked up the fastest, do you think? What
Mm.
should loved ones be looking out for, whether it's your friend, or whether it's your daughter or a niece or nephew?
Yeah, anyone in your circle, really, in
Yeah,
your
yeah,
community. Um, it would, well, it would depend on the eating disorder diagnosis, but if I was looking at something like anorexia nervosa, so a
yeah.
restrictive eating disorder, um, yeah, you're looking out for changes in food habits, potentially in what we might call rules around foods. If you have a child who, for all of their life, was fine with eating bananas, for example, and
Mm,
then all of a sudden they stop eating bananas and it doesn't sit with you. And you know that
mm,
there's something there and you're like, okay, what's going on here? And you might notice that in other things. And sometimes there are these rules or these ways that the eating disorder can hide, like, oh, I'm full. Oh, I already
mm,
ate. I don't like eating at school. I don't like eating with my friends. These sort of rules start coming through that sort of hide the restriction that might
mm.
be there in terms of how they're eating and what they're eating.
Yeah.
Um, Obviously, if weight loss is involved, that can be something to look out for too.
Mm,
And also their relationship with that weight loss. So,
mm,
are they able to talk about it with you? Are they able to talk about body or weight in general? You mentioned something that's really poignant there, Monique, about uh, baggy clothes and sort of and hiding weight loss through baggy clothes. And in the eating disorder space, we sometimes call that body avoidance, I believe. It's sort of like a way of really disconnecting from what's happening there and what's happening with the eating disorder in relation to your body.
yeah.
And you picked up on a really important sort of intersection of, well, where culturally is that coming into play in terms of how the eating disorder can exist in this space.
Mm,
But there could be other things around body avoidance that you might need to look out for.
mm.
Are they avoiding their reflection? Are they Gosh, there are so many things. Sorry, I'm
Yeah,
getting quite specific now.
I think what's really interesting is I think when you start to ask people directly, around how they feel about their body,
Mm,
or just starting to tap into beliefs, there is often avoidance there, even in answering that question to begin with.
mm,
You,
yeah,
you, you know, it's not like, oh, well, I hate myself or I don't like my body. Even for that to come out, takes a lot of courage and bravery for people to share.
vulnerability. Yeah,
Absolutely. To share, your relationship with the skin that you're in, the shape that you're in. And so
absolutely.
when we, I think when we start to really think about, particularly as helpers or parents or professionals, ask questions is one is to be very, very sensitive about how to go about it. But what are some of the questions that, you use as a telehealth counsellor, particularly people are ringing you, obviously. And what are some of the questions, the soft startup questions that you use? Because it's, like, look, you've got 5 sessions, you don't want to muck around, but at the end of the day, you want to maintain a relationship and a rapport. And I just feel like if we could help, parents or friends to ask questions that,
I think what I would do in my role would probably be different to how I would be advising parents or friends or people in the community to address it. There's something there about people can self-refer and often do self-refer. So there's an understanding of why they're there.
yeah.
If you're talking about potentially engaging in a conversation with a loved one for the first time,
Mm,
that's a bit of a different story. Um, you, like any sort of challenging conversation, there's something there about your role, what you can do,
mm,
what you're able to offer as well. So being aware of your role in relation to this person and what you can offer, and then also how you approach that conversation. We talk a lot about using I statements. We talk a lot
Mm,
about trying to understand eating disorders to start with, so you sort of know what you're trying to engage with. We talk about understanding that this person is not choosing this, like this is by no means a personal choice.
mm, mm,
We talk about trying to validate the experience that they are having and understand that it could be incredibly scary for them and stressing for them, but that you can still affirm that you would like to help them and that for you, this is what you're seeing.
mm.
Does that
Love
help?
it.
Yeah.
Yeah, yeah, they're great. As okay, if that's your do's list, what's your don'ts?
Well, this is challenging. Again, it would depend on like everything, right? Depends on the person, depends on your relationship to them, depends on the disorder.
Yeah.
Um, it depends how ready they are for help, how ready they are to talk about it. Um, it depends on the age of the person as well. There's a lot
Mm,
in there about, are they underage? Are they overage? Are you a parent with an adult child? Are you a parent with a younger
mm.
person? That changes the dynamic and the way that you can actually approach it.
Yeah,
Yeah.
absolutely. Speaking of age,
Hmm.
how young is young? Like, as in, how young, often, I'm just wondering what the common occurrence is or prevalence is when emerging disorders first make themselves visible. But how young is young? Like,
Young
what are you
is,
seeing in your service in terms
yeah,
of young, children, primary school emerging with eating disorders?
yeah. So I believe there was actually a report recently by Butterfly Foundation, and I'm not good with stats, so I won't claim to know the numbers, but
Right.
I think there was a significant increase in, I believe, the 12 to 14-year-old bracket. And we're seeing that in some of our services that deal with like family peer support. So
Mm,
we're working with the parents. I know that some of our carer coaches are seeing an increase in that younger 11 to 13-year-old sort of space come through. Obviously, still very prevalent in all ages,
yeah,
absolutely.
yeah.
But it can happen younger than that as well.
Mm.
There is a particular eating disorder as well called ARFID. Do you know much about ARFID?
No, I don't think so.
Yeah, so ARFID is avoidant food intake, no, avoidant restrictive food intake disorder. And it sits a little bit differently to the others because there isn't often a preoccupation with body image or body or weight.
Mhm.
You might be um, significantly changing the way you interact with food, but it's not necessarily purely from a restriction point of view either. So for example, it could be certain foods that are a certain color or a certain sensitivity, they have a sensory
Mhm.
element. It could be that you're avoiding food because there is a phobic element to it. You're scared of choking when you eat. Maybe something
Mm.
happened. Maybe there's been
Mhm.
like a physical trauma. Um, it's often seen, and I make no claims, but it is often seen sitting alongside some other neurodivergence, and that can actually pick up really young, and we can see quite
Yeah,
young children experiencing things
yeah,
like this.
yeah,
Yeah.
yeah, yeah. I've certainly seen that. Yeah.
Mm,
Um, okay, okay. Well, okay. So I'm just wondering about the don'ts. I think if there were themes there, and we were working with maybe
yeah.
good friends or parents, and I know that that approach in itself could be a little bit different, but maybe we'll just stick with parents for the moment. And I know depending on the age of the child, we're going to always modify what we say to children and when. If the child is in primary school, we might be a little bit more directive and say, eat your dinner, or don't you want to grow up big and strong? But I'm wondering there around maybe, and you can frame it in the do's, around what is body positivity, and how do we avoid the use of shame?
$1 million question, Monique.
Mm,
How do we out in the world avoid shame? Well, that's it. We're trying not to blame people. We need to understand that everyone is either coping as best they can, that potentially they've got a significant psychological illness sitting
mm,
alongside them at the moment, and that is by no means their fault.
mm,
We don't want people to feel as if They are the burden in their own life experience.
I think it summarizes that beautifully, because I think what happens is if we are unfamiliar with essentially the type of behaviors that constitutes an eating disorder, then we are, as parents, probably more likely to view it, particularly for teenagers, any type of different behaviors of eating or a different relationship as a choice.
Mm,
Then why are you choosing this?
mm,
In a very similar way that if parents don't understand depression, parents might, why are you choosing to sleep all the time? If you only just got up and went for a walk, or if why don't you come out and eat dinner at the table with us, and make a whole lot of statements, because you're not recognizing a cluster of behaviors that could be right in front of you. So of course your brain goes into all sorts of other interpretations, and we want to make it about choice. It's
absolutely.
almost easier if our kids are choosing to eat or not eat or stay in bed or get up. It's almost easier, because then we've just got to tell them what to do and then they should do it.
Totally.
Good
I
luck
also
with that.
no, it's very insightful, Nick. I think that's absolutely correct. And also potentially a very adult way of looking at the world. You know, we're used to being somewhat in control and able to make choices for ourselves. And um, it's a confusing time, adolescence. I don't know how self-aware you can really be sometimes.
Yeah,
So a lot of people who are experiencing an eating disorder, disordered eating, depression, other mental health illnesses, they might not have a and a level of awareness themselves about what's happening for them.
right. And therefore I think having that soft approach, seek to understand, use I statements, which is, often, you know, I'm feeling quite worried now.
Yeah,
Yeah. Or I
absolutely.
really care for you, you know, um, and sort of expressing, or also
I've noticed as well. I've
I've
noticed.
noticed, that's a good one. Okay, what else have you got?
Well, I've noticed, and then you're trying to open the curiosity around, what are these behaviors that you've noticed?
Mm.
Um, if you can be curious without being judgmental, that's the sweet spot, I think.
Curious without being judgmental. I like that. I like
Mm,
And I think as parents, sometimes when we want to have those deep conversations, and sometimes with friends too. And what's really interesting is I think that we very naturally can do this with friends, but sometimes parents find it hard to be that friend to their kid or their adult or their young person, and to use that voice, not parent voice.
yeah.
It's to use the friend voice. I think that's, it's like, okay, well, if you had a friend who was experiencing this, how would you talk to them? And that's probably the voice you need to bring.
Yeah, I think for
Yeah,
this early engagement,
yeah,
absolutely. If
yeah,
you're like into treatment and you need to be like getting this person,
right,
renourished and all of that, different
yeah,
question. But
yeah.
for anything, yeah.
So how can people with eating disorders be helped? What are the types of treatment options that are available? Where can people go?
We always say first point of call pretty much is trying to speak to a GP. So especially because sometimes getting eating disorder treatment requires an eating disorder diagnosis or
Mm,
some level of acknowledgement there. So speaking to a GP, they're able to give a diagnosis, and once they have a diagnosis, they can actually create potentially an eating disorder plan
mhm.
or a mental health care plan. So they both work quite similarly.
Yeah.
Or refer to a specialist treatment service or a specialist treatment provider or just a community mental health practitioner, whatever it is that might be necessary.
Mm, mm. And so how do people reach you? How can they find you?
They can find us. They can find us through
Yeah,
our
yeah.
website,
Okay.
eatingdisorders.org.au, I believe. Let me double
Right.
check
We'll put that in a link in our bio.
that. We've also got a phone they can call 1300 550 236. It's manned by volunteers and they're beautiful and they do their best.
Excellent. Well, thank you so much, Myah, for giving us a really good overview as to what eating disorders are, and I think just as a first little gateway to getting, to seeking, I guess, helping our communities to understand what they are, where to get more information, the type of help that's out there. Optimistically, it sounds like there are lots of different forms of help for people, no matter where they are in their illness, whether they don't even know whether this is an actual big problem for them versus someone who might have experienced eating disorders for some time and be in sort of a later phase of maybe a relapse or something like that, but knowing that no matter where you are, also as someone who's experiencing it or someone who's caring for someone, that there is help out there. I think that's a really important message. Everyone feels very stressed when we don't have the answers, and even when there is a big issue before us, we can just tend to reduce our stress levels, knowing that there's other people out there who have those answers and that can form a bit more of a support team or a community of care. And I think it's a really important issue that, like many mental health issues, are very hidden in community and full of misunderstanding and a little bit of stigma. And I think the more that we talk about it, and can get this type of information to different parts of our community, hopefully we can get more people out there who really do need the help, and to get early intervention, as what we were saying before, as quickly as possible, but also to, I guess, bring people into a sense of community to go, we don't need to be perfect. And sometimes we find ways of coping. We don't always choose our illnesses, do we? No, we don't. But to know that there's people out there like you, Myah, it's been really lovely to talk to you today. And someone would be very lucky to get you on the other end of it. Sure. You're very thoughtful as a counsellor by the sounds of it in the very short interview that we've had today. Thank you very much for joining us. And thank you for Eating Disorders Victoria for releasing you today and sharing the great work that you do. Any last words? Any?
No, I'm a little bit stunned by all that flattery, but I'll take it, and I'll take it on behalf of Eating Disorders Victoria as well.
Therapists don't get enough, you don't get enough credit. Your work is in silence. You help someone, they say thank you, they hang up, and then you pick up another 20 phone calls. So your work is amazing, and I think the work of the other therapists that you work with, or telehealth counsellors, is really wonderful. And where would our communities be without people like yourself? Oh, I've got one last question. What if someone doesn't speak English?
Great question, Monique.
Yes.
Absolutely
Where can they go for
wonderful
it?
question.
Is there any bilingual resources out there in the big wide world? It may not be with your organisation. It may be, is it in the pipeline for people to access information if their first language is not English?
I would love to say it's in the pipeline, but I think that it would discredit everyone if I didn't acknowledge that this is a really big black hole that's sitting in the eating disorder space right now. Huge black hole. We are very aware that there is a stereotype of an eating disorder experience that isn't at all true or representative for what an eating disorder experience is in reality across, especially in a country like Australia and Victoria with a huge migrant population.
Yeah.
And we also know that for whatever reason, the eating disorder space is perpetuating that stereotype. We are still seeing certain stories, certain presentations portrayed in media, or even coming through our door as service providers. So honestly, we're not well resourced. And I speak for Eating Disorders Victoria, but potentially even across the board at the moment. And there will be some bilingual practitioners out there, and there are potentially some, like I know Shapes and Sounds might be an avenue for people identifying with Asian descent to go through. There are also the Centre for Muslim Wellbeing could potentially help you find a practitioner that can potentially speak your language and also deal with eating disorders. But there isn't a significant leading body at the moment, but we're working on it, is all I can say.
That's great. That's great.
And we appreciate this space here because I think this is really important as well.
Well, thank you. Thanks, Myah. All right, you take care. This has been another episode of Be Well, and I'd like to thank Myah for joining us and talking about eating disorders. Be well and see you next episode.